Dr. Raam Lakhani. I work at the Watson Clinic in Lakeland, Florida. I've been here for about 13 years. I have a varied practice, both ear, nose, and throat surgery, as well as facial plastic and reconstructive surgery. I started an undergraduate and medical school at the University of Miami. I am board certified, double board certified in fact, both in ear, nose, and throat, as well as in facial plastic and reconstructive surgery. Training is not over when you're done with college. It goes on, and quite frankly, that's why they call it a practice. As far as maintenance of certification, you constantly have to go through board certification. Recertification occurs every 10 years. Plastic surgery initially became interesting because of the reconstructive side. In Michigan, we did a lot of traumatic and difficult cases with congenital deformities, and that kind of piqued my interest initially. Our team is exceptional. They make us very different as far as the personal touch and care. They have been bar none, and they are so meticulous in how they care for each individual patient. What makes me different from other doctors, particularly in this area, is the background and training. Another difference perhaps is the side where we give in terms of doing things for the cleft lip and palate patients, the trauma patients, some of the cancer patients that come through, have traveled abroad and done cleft lip and palate work. Some of those things are, I think, a little bit different than what you'll see normally. My practice is varied. I do quite a bit of plastic reconstructive, both the reconstructive and cosmetic sides. I also have a very busy head and neck surgery, ear, nose, and throat side to my practice as well. That side is kind of a nature of where I practice in Lakeland. On the plastic cosmetic side, we have a variety of surgical procedures that I do. The more common ones are going to be facelifts, eye lifts, noses, rhinoplasties, brow lifts, various types of neck lifts. Those are all the more common things that we'll do surgically on the cosmetic side. The majority of our cosmetic surgeries are done in the office OR. In the office setting, we have procedure rooms that function as state-of-the-art ORs. They have all of the equipment, all of the amenities that you would wish for. The cleanliness, the sterility is, of course, of the utmost importance, and we provide all of those things. So the majority are done here for various reasons, but we do have the surgical center, which is part of our practice, part of our group. One of the most common procedures that we will do from the cosmetic side is a mini facelift. It's less invasive, requires less recovery or downtime, so of course that is very appealing to a lot of folks. It is a little bit limited in terms of the amount of tissue that's lifted, so you do have to be a little bit cautious in who you recommend have that procedure. Some folks do need a full facelift or a more aggressive approach. Others do beautifully with our mini facelifts, and frankly, the majority of our patients do have the mini lifts and are very, very pleased. So mini facelifts can be done either in the office or in the surgery center setting. Either one will work well. The level of anesthesia is the primary difference between the two. The quality of the service, the procedure, the end result, identical both places. The in-office OR provides a level of sedation, so you're kind of out of it, so to speak, so you're comfortable, relaxed, not as anxious. And then we have plenty of local anesthetic, both topical and injectable, that provides the rest of the anesthesia beautifully. And it does end up becoming a little bit quicker recovery. As far as eye lifts, they can be considered cosmetic or reconstructive in theory. The reconstructive side is for those folks that are typically older and have a lot of heaviness to their upper eyelid skin. We want to shape and contour, open up the eyes, make you look brighter, well-rested. All of those things can be accomplished with a cosmetic eye lift. There are a number of non-surgical options nowadays with regard to cosmetic facial procedures. Botox has been an excellent option for many, many decades. As far as how that works, it relaxes the muscles, it opens up, lifts the brow, opens up the eyes, so beautiful option for the upper third of the face. With Botox, it's one of the quickest procedures that can be done. You can basically come in, we usually do a little topical numbing, which takes the edge off quite a bit. That'll sit there for a good 20 minutes or so. Once that's done, the injection component takes 5 to 10 minutes, and the downtime is negligible. Very few people will have any bruising or swelling with it. You can certainly come in on your lunch hour and have Botox and be good to go for the rest of the day. You did great. We'll see you in a couple of weeks. Okay. See if we have to do any touch-ups or clean it up a little bit, but this should be beautiful. Open you up right.
Thank you.
You're very welcome. You have to be prepared to give it a good 72 hours or so to start to see the initial effects. Some take up to a week to 2 weeks for the final result to show up. So you just have to be patient during that time frame. In my practice, we always have follow-ups around that 2-week time frame so that if there are areas that we need to treat a little bit further or contour a little bit better, we can certainly achieve those things. As far as the longevity of Botox, everybody's a little bit different in terms of how quickly it's broken down. Typically 3 to 6 months is what you'll get out of Botox. Another newer non-invasive option would be fillers. I say newer, it's been around for quite a while, but the advances have been such that the products, the longevity, the potential for allergic reactions, all those things have become so much better in terms of how these products are bioengineered in a lab and not animal-derived. They are so much easier to work with in my hands as I look at myself as an artist in a lot of ways. Now you can contour the midface with fillers in such a beautiful way and accommodate for the asymmetries that we all have in such a precise manner that fillers are an excellent non-invasive option. A lot of the newer fillers are immediate result type products. It's pretty cool. You get to literally see the results as we go. In fact, for most of my patients, I have them hang on to the mirror as we're injecting.
It was. I can see a difference already.
So that they're comfortable with the process. And my personal approach is a more conservative one, so that we're not getting too aggressive and creating a caricature of my patients. We want a good, solid, natural look, something that looks rejuvenated and not overdone. It's going to be a little bit more downtime than Botox. You can certainly come in, have the injections done. Similarly, we'll use a little bit of topical anesthetic. We'll go ahead and inject thereafter, and the results are beautiful. But with the filler, there is going to be a little bit more swelling. The potential for bruising is also a little bit higher, so you just have to be prepared for that. Those that are a little bit more conservative may not want to go right back to work. Others have gone back to work and been fine with it. They're much better nowadays. They last quite a bit longer. The olden day collagen used to be about 3 months, which is kind of unacceptable if you're going through all the effort and cost of doing these things. So nowadays, the fillers, the hyaluronic acid fillers, will last anywhere between 6 and 12 months. Some will last longer, depending on how quickly the individual metabolizes it. And then some of the others will last even longer. The hydroxyapatite, the Radiesse, various things there can last 15 months. In fact, some things like Sculptra and Voluma claim to last up to 2 years. So with regard to skin resurfacing, many options. There's a full range. In our practice, we have a number of in-office lasers as well as laser in the surgery center. The way lasers work is relatively simple. There's something in the skin that will attract that laser energy. With regard to resurfacing lasers, those that take away the sun damage, the fine lines, furrows, those lasers are water-based. They'll be attracted by the water molecule in the superficial skin, so they're called resurfacing lasers. Fractionated lasers are kind of the latest and greatest in that realm. We have a number of those in the office. We also have the more aggressive option in the operating room, which is the traditional CO2 laser. Those that come in with really deep furrows and lines may need that, depending on the age group and what they're trying to achieve. And we've had such great success with that as well. The patients have been so happy. Certainly chemical peels can be done for resurfacing and rejuvenating the skin. And then skincare lines can be used as well. Most of our chemical peels are done in our spa setting, where they're lighter peels, things that'll kind of just perk up in a sense. Deeper peels can be done in the office as well. And then with regard to the skincare lines through the spa, we have the full range. But living in Florida, as you know, it's a very important thing to do because sun damage is probably the most pressing issue when we talk about keeping the skin looking younger and keeping it cancer-free and healthy. Interestingly, there are various things about the face that will give away the age. I call them the telltale signs of aging. So in a consultation, I'll typically sit back and assess the whole look. And for a lot of folks, there will be certain things that draw your attention. And those are the bigger things that I kind of look at. And as I step back, a lot of times the neck is the area, the neck and the jawline, that draw the attention first. In rejuvenating those areas, there are various techniques. There's a new product on the market called Kybella. Kybella is basically meant to remove the subcutaneous fat. So it's an acid that's injected, safe to use, has to be injected in a somewhat meticulous way. You want to stay in the deeper tissue. But basically it works to dissolve the fat over time. Initially there will be some swelling associated with it, but over time, as the fat dissolves and resorbs, the skin generally comes back up. The only caveat to that is that you want to pick somebody that has good elastin and collagen in their skin so it snaps back and doesn't sag after the fat is gone. I do love what I do. I'm very fortunate from that perspective. I enjoy the artistic side as well as the scientific side, the way that my brain is working all the time and analyzing and assessing and getting to do and getting to see the actual results, the fruits of your labor. It's so rewarding in so many ways. And of course, being able to touch the lives of people in such an intimate way, making them more confident, more pleased with their everyday lives, and from the reconstructive side, getting them back to a point where they're so comfortable being in and around, getting to see their kids and grandkids, or with the cleft babies speaking and eating and going to school and flourishing. I've seen so many of these kids become young adults over the years, and they're so successful. It's a passion and it's a pleasure to be able to provide this for people.